NeedyMeds users and friends. Thank you for joining me for the Healthcare Savings with Diagnosis-Based Assistance Programs webinar. I'm Carla, the Director of User Engagement at NeedyMeds. And before we get started, I'd like to offer a few tips so you can make the most out of today's presentation. You can feel free to ask questions by any time by typing them into the questions section of your GoToWebinar control panel. But no, I will reserve answering questions until the end. If I don't get a chance to answer your question, I will follow up with you by email. But of course, I will provide the contact information for NeedyMeds and my contact information at the end of the presentation. This webinar is being recorded and will be posted on the NeedyMeds YouTube channel. And you can find a copy of this PowerPoint slide deck and other materials I thought you'd be interested in that handout section of your control panel. So with this presentation, I'm going to cover what NeedyMeds is, what are diagnosis-based assistance programs, and how they can help you afford your healthcare expenses. I'll also share with you other savings resources that you might find helpful, as well as easy ways to stay in touch with us and up to date on healthcare topics. So let's get started with what is NeedyMeds. We are a national nonprofit founded over 2 decades ago by a retired family physician, Dr. Richard Sagel, and a medical social worker, Libby Overley. Rich is still the NeedyMeds president. On the screen is our mission statement, our vision statement, and a statement about how we achieve our mission. But simply put, NeedyMeds connects people to programs that will help them afford their healthcare expenses. And we do that free and anonymously through our helpline, 1-800-503-6897, and our website, needymeds.org. And one of the most popular and effective ways we help people save on healthcare costs is with our large listing of diagnosis-based assistance programs. Diagnosis-based assistance programs are usually supported by private or government-funded organizations, and they offer financial assistance for necessary medical expenses associated with a particular diagnosis. Usually, this refers to costs outside of medications. It may include helping to cover costs such as medical supplies, durable medical equipment, testing strips, or even help affording things like wigs, hearing aids, child care, house cleaning services, help getting a service animal, or assistive technology. Some programs are national in scope, while others are limited to residents of a specific state. Some cover one specific diagnosis, such as breast cancer, while others offer help with whole categories, such as types of cancers. Most do have some type of eligibility requirements, and those are usually financial ones. So, how do you find diagnosis-based assistance programs on our website? Let's go ahead and switch from the PowerPoint to the live website so I can demonstrate. Like other NeedyMeds healthcare savings programs, diagnosis-based assistance programs can be found under the Healthcare Savings tab. Simply let your mouse hover over or click on that Healthcare Savings tab. And when you do, as you can see, a whole bunch of different healthcare savings resources pop up. In the center section on the top, you will see a hyperlink for diagnosis-based assistance programs. And you can see the programs are sorted in 4 ways to help you search for what you need more quickly. You can search very narrowly by the name of the disease or diagnosis, the state the program is offered, and the type of help or service the program provides. You can search by the name of the program if you're familiar with a program specifically. You can search geographically to see what's available in your state, and you can also search by diagnosis, which is the most common way to search. So let's go ahead and search for a diagnosis-based assistance program for diabetes. So I'll go ahead and click on that search by diagnosis hyperlink. And I'd like to use the example of diabetes since not only is that a common diagnosis in our country, but it's a great example of a diagnosis that requires a lot of expense in addition to medication. Oftentimes, those living with diabetes need help affording expenses such as testing strips, meters, syringes or sharps, or assistive technology, for example. So let me make the screen a bit bigger. And as you can see, on the diagnosis-based assistance page, there's an easy A to Z index. I'll go ahead and choose D for diabetes, and then I'll scroll down the list of diagnosis until I find diabetes. Now, since diabetes is a big category, we have it broken down into a bunch of subcategories, as you can see. But for the purposes of demonstrating in this presentation, I'm just going to go ahead and click on the general diabetes category. Now, you can see at the top, there are currently 89 diagnosis-based assistance programs for diabetes. I say currently because programs change all the time and new ones are added all the time. So that's actually a good time for me to remind you to regularly check our website. If you're not finding assistance for a specific expense today, you may find it at a later time. So let's scroll down and look at what these 89 diagnosis-based assistance programs for diabetes offer. And hopefully you'll agree that all of the important information is now on the screen, including the name of the program and a hyperlink if one is available, a summary of the program, and the two right columns which you will be most interested in: the services the program provides and the area of service, meaning where the applicant has to reside to be eligible. National programs, meaning you are eligible to apply if you live in any state, are listed first at the top, and then they are listed alphabetically by state as you scroll to the bottom. Let's talk for a second about the services provided column. What I mostly want to point out here is many of them offer things like help affording medical supplies and expenses or assistive technology. But as you can see, they vary greatly. This program offers help for respite care. These programs offer help getting access to a service animal. The point is, they all offer different things, so it's worth scrolling through the programs to see which ones may help you, your loved one, or your patient or client. I also want to bring your attention to some more of the wording at the top of the page. I mentioned that at the top you can see how many diagnosis-based assistance programs are currently available for diabetes, but you can also see if there are camps and educational scholarships for those living with diabetes, and you can visit our diabetes diagnosis information page for educational information about diabetes and other healthcare savings options. Now, diabetes is an example of a diagnosis that may require people to self-inject. Yet, there are limited options for proper disposal of needles and sharps, which can lead to dangerous situations for the public and workers, causing exposure to a variety of potentially serious diseases. So we're encouraging you to use our safe needle disposal site on the left-hand side. Excuse me. And on that safe needle disposal site, you can find a box that I just saw on the left-hand side of NeedyMeds.org. And on this site, you can find out how and where to responsibly dispose of home-generated sharps. Now let's return to NeedyMeds.org, because at the beginning of this presentation, I mentioned that this webinar is being recorded and it will be available on our YouTube channel. And you can find a link to our YouTube channel and type right hand of our homepage with the rest of the social media icons. It's the third one from the left. So let's transition out of the live site, bear with me while I do that, back to the PowerPoint so I can talk to you about all the other healthcare savings programs under that Healthcare Savings tab. And I'll also offer some tips for diagnosis-based assistance programs. So returning to that healthcare savings tab, and let me make this screen a bit smaller so you can see all the categories that pop up. And again, you can let your mouse hover over or click on that healthcare savings tab. And under here, you will find other healthcare savings resources. On the top left-hand side, you will find prescription assistance programs. And these programs provide the most savings for brand name prescription medications. You will also find the $4 generic medication. Oh, just bear with me while I transition one more time out of here back to our PowerPoint because I really wanted to make sure I had the healthcare savings screen up on the site. So bear with me just one moment. Here we go. So we're talking about all of those other healthcare savings resources. And again, I mentioned they will be under that healthcare savings resource. And I was just showing you them on the live site, but I really wanted to have the stagnant page up so you can get a good look at all of these healthcare savings resources. So we talked about finding prescription assistance programs, which provide the most savings for brand name prescription medications. Under that, you will find our section for $4 generic discount drug programs. This section is a great resource for finding generic medications for a discounted price, and you may find your prescription even at a lower price than your insurance company. If you're in need of affordable primary and preventive care, search the free, low-cost, or sliding scale clinic section for convenient locations for medical, dental, mental health, or substance abuse clinics. Now, there are more than 18,000 clinics nationwide in this category, so chances are you will be able to find one convenient to where you live or work. Under that, you'll also find another popular destination on NeedyMeds.org, which is the coupons, rebates, and more section, which is where you can be connected to discounted over-the-counter drugs, prescription meds, and medical supplies with just a quick click of your mouse. And like so many others, if you have been impacted by the pandemic, visit our COVID-19 Resource Center. It's full of programs for those experiencing financial hardships and struggling with healthcare expenses due to the COVID-19 coronavirus. Now, oftentimes getting to and from a doctor or specialized facility causes a financial burden. Look for a program that can help you afford medically related transportation expenses under the medical transportation section. We also have categories that provide camps, retreats, recreational programs, and educational scholarships for people of all ages living with specific diagnoses. The government program section is another important destination to search for government-funded healthcare programs in your state. And under the Healthcare Savings tab, you will, of course, find a link to the NeedyMeds Drug Discount Card, which can help you save up to 80% off prescriptions. It can save you on also your over-the-counter medications and supplies, as long as they're written as prescriptions. It can be used to save on human equivalent pet meds, and it can also be used to save 40% off medical equipment. So when you have time, please spend some of it checking out these additional sections of our site. Now, I mentioned when we transition from the live site back to the PowerPoint, in addition to mentioning these additional healthcare savings resources, I said I'd like to offer you some tips about diagnosis-based assistance programs. So let's talk about that now. When you're looking for diagnosis-based assistance programs, first, look for your specific diagnosis, such as breast cancer. If your specific diagnosis isn't listed, then look under the general category for your diagnosis. In this case, for example, it would be cancer or chronic, serious, or life-threatening illness. You can also look for programs that may help with a specific need that you may have. For example, if you have breast cancer and chemotherapy has caused hair loss, you can check out the hair loss chemotherapy-induced section in the diagnosis list. Check also to see if we have cost savings programs for your other healthcare expenses or medications. Alleviating other costs may free up your budget so you can afford your other healthcare needs. Please don't forget about visiting our diagnosis information pages, where visitors can search for cost savings programs related to their diagnosis, including prescription assistance programs. And those diagnosis information pages also have tons of up-to-date and accurate educational information about your diagnosis. Now, if you don't find a diagnosis-based assistance program, check out the coupons, rebates, and more section to be connected to discounted over-the-counter drugs, prescription medicines, and medical supplies. And be sure to revisit our site again and again, because as I mentioned, we update programs regularly as well as add new ones. And finally, call our expert call center counselors at 1-800-503-6897. They are available weekdays from 9 a.m. to 5 p.m. Eastern Time, and we do also have Spanish-speaking counselors. Now, on the top right of our homepage, you saw a bunch of social media icons. This is where you can find links to our Facebook and Twitter pages. That's also where you can find that YouTube icon. We're hoping you subscribe so you'll be notified when new content such as presentations, webinars, and videos are added. You can also find NeedyMeds on LinkedIn. And next to that LinkedIn icon, you will find a link to our blog, the NeedyMeds Voice, where you can read timely, provocative pieces on healthcare-related topics, and you can sign up to receive that as well. You can also follow us on Pinterest and Instagram. Now, under the Advocates tab on NeedyMeds.org, you will find our subscription services. Here, you can order print materials such as our drug discount cards and brochures, and sign up for email alerts about program changes. You can also share or print many of our most popular brochures. You can also sign up for our upcoming webinars, our monthly e-newsletter Vitals, and learn about becoming a NeedyMeds Volunteer Ambassador. If you're joining us today and you represent a group or organization, check out how NeedyMeds can create a customized drug discount card with your business's name and logo free of charge, and learn about other partnership opportunities. Now, let's get to some of those questions that have been coming in through this presentation. And again, if you do have questions, you can go ahead and submit them into that question section of your GoToWebinar control panel. And a reminder, if I don't get a chance to answer your specific question, I will follow up with you via email, or of course, you can reach out to our call center counselor. I want to leave up our contact information as I get to some of those questions coming in. If you are looking to order some drug discount cards and our most popular brochures, send an email to my colleague Alana at needymeds.org. If you have any questions regarding this presentation or the information covered, you can reach me at carla@needymeds.org. Once again, I want to leave our helpline phone number up, 1-800-503-6897. Don't forget, we're in Massachusetts, so we are open weekdays 9 a.m. to 5 p.m. Eastern time. And of course, please take some time to familiarize yourself with other cost savings and educational resources you can find on needymeds.org. So let's get to some of those questions coming in. The first one is, what happens if I can't find a diagnosis-based assistance program? So thank you for that. That's a great question. Now, first, I would recommend checking out our coupons, rebates, and more section. That's where you can look for discounted over-the-counter drugs, prescription medications, but also things like medical supplies and durable medical equipment, as long as you have a prescription for those. Now, if you don't find a program, you can always use the NeedyMeds drug discount card to save up to 40% off durable medical equipment, such as diabetic supplies, splints and braces, catheters and incontinence supplies, mobility devices, bladder control programs, and a lot more. You can request a card from our website or by giving our counselors a call. And remember to revisit our website. If you don't find a program today, one may be added at a later time. And I really want to stress, if you have trouble finding what you need on our website, our call center counselors are there to help you. Thanks for the question. Another question coming in: are there residency requirements for diagnosis-based assistance programs? That's another great question. So most of the time, no. Those applying usually just need to live in the United States to be eligible. But on the diagnosis-based assistance program page, you will specifically find the eligibility guidelines for that program. So with a quick glance, you will know if you or the person you are assisting is eligible. Also, the program phone number will be listed at the top of the page. So if you have any questions about the residency requirements for those that may or may not be eligible, or any other questions about that program, don't hesitate to reach out to that program directly as opposed to NeedyMeds. Thank you. That was another great question. So another one coming in. Oh, this is a good one too. Can I be notified when new programs are added? And the answer is yes. I'm pleased to let you know. Under that subscription center, under the Advocates tab that I pointed out in the last slide, you can sign up for daily or weekly email alerts so you can be notified when there are program changes to diagnosis-based assistance programs, as well as prescription assistance programs. Now, I do try and keep the question segment brief. So again, if you asked a question and I didn't get a chance to answer it, I will email you. For now, thanks so much for your time. I hope you were able to learn a little bit about diagnosis-based assistance programs and how they can help you, your loved ones, your patients, and your clients. And we do hope to see your name pop up in future webinars. Thanks so much for your time, and please stay in touch. And don't forget, NeedyMeds. We're here to help.